the Northwest for Thursday afternoon. It's John Breslin with you until 2:30. Now, if you've ever had some surgery or procedure that requires an anesthetic, well, you know the drill. Eventually, you're given the count and start at 10, and if you get to 7 or 6, you're doing well. But what happens from when you conk out and go into la la land to when you come back again and can look forward to the tea and toast? Well, the person that put you under, so to speak, do they just wander off and sit on their phone for an hour or two, or what do they do? And why are they always asking about when you've eaten and sometimes what you ate? Well, there's a new book anyhow that includes details on all of this, observations of an anesthetist, and it's written by Derry-born Dr. Colin Black, who is an anesthetist at Crumlin Hospital for Children in Dublin. And the book, well, it's serious, obviously, in the places, but also it's very funny in other parts. A very honest account of what goes on behind the scenes. And I'm delighted now that Colin joins us on the line, and we're streaming as well on Facebook. Colin, how are you?
Hi, John. Thanks very much for inviting me on. I'm very well, thank you.
Good. Now then, what does happen? I take it that you do actually stick around for the operation.
Yeah, so contrary to those myths, we do actually have to stay there for the entire duration just to make sure that you're okay, because our job doesn't finish once we put you off to sleep. We have to actually keep you asleep and keep you safe during the operation. So the old myth of us just heading off to the office with a copy of the local paper is not true. There's actually a little bit more to the job than that. So that's one of the reasons I wanted to write the book, Gas Man, was to sort of explain what happens beyond that, because most people just meet us for a couple of minutes and they forget the rest, but there's more to it than that.
The title is Gas Man. Given that you wanted initially to become a physiotherapist of our Premier League side, you kind of missed a trick. You could have called it Theatre of Dreams.
That's actually maybe that's the one for the follow-up. That's pretty
Right.
good. That's
Okay.
pretty good.
Yeah. Anyhow, and to start off the process, it's about, because I've had it a few times for various sports injuries, and I suppose the key is putting people at ease. You go into that sort of ante room, if you like, and
Yeah.
it always seems to be cold in there, but it's about putting people at ease and getting them to relax a wee bit.
Well, it is, yeah. I mean, we try and give people an opportunity to ask us questions beforehand and sort of ease their tension a little bit, but it's often not enough, and people are terrified when they come in to see us for good reason, I think, because it's a very strange scenario you find yourself in when you're used to making all your life decisions by yourself and having control of everything, that you now have to, I guess, relinquish control of your life to somebody who you've only met very recently. So most people are quite nervous about it. And then I work exclusively with children. So obviously there's the added side of trying to get a child to comply with your whatever silly story I've made up on the day and actually take a mask and fall asleep. So there's tension in adults, but there's often a bit of chaos with the kids.
I can only imagine. It's one thing to go in for a bit of routine knee surgery. It's another thing entirely when it's a small child, and it's life changing.
Well, it can be, yeah. I mean, thankfully, not every operation we do in a kid is a life and death thing. They get minor ailments as well, so we don't have to deal on every single day with a life and death operation. But they do happen most days of the week. And it can be tricky, with working with kids. It's not just the child that you're trying to put at ease or help them relax or help them go asleep. It's often the parents that you're working the most to reassure and explain exactly what's going to happen, because don't forget, this might be the first time they've ever given their child or left their child with somebody that they don't know. So for those bigger operations, there's certainly a lot of talking, there's a lot of questions, and there can be a lot of tears as well sometimes. But most parents can keep the tears back until their kid goes asleep, and then afterwards, when they're unconscious, it's fair game, and the waterworks often start, which is fine as long as they're try and remain a little bit stoic for the kid when they're going off asleep. It makes my job a little bit easier.
Yeah, but I'm sure no two cases are the same, and it adds another dimension entirely when it's children, because you have a parent in the room when they're being put to sleep. It's different when it's an adult. It's just you and them, and you can have that conversation, and you can have the standard countdown and so on.
Yeah, well, you can, yeah. So I mean, adults are you don't have to discuss your medical information with anyone else aside from yourself. So we do have these conversations one on one with patients in an adult atmosphere. And, sometimes I don't think they've asked all the questions that they want to ask. They go asleep probably with another 20 questions that they wanted to ask you. But when you're put in that moment and you see all the lights and the monitors being attached, your mind can go blank and you just forget what you wanted to ask and just go along with the flow.
To me, it's a bit like flying in an airplane. Some people get really nervous about flying, and you just have to put yourself in the hands of the professionals. And in you we trust, and as a result, because there's an old saying, accept the things you cannot change, and therefore you may as well relax. What is the point in being stressed? Easier said than done sometimes.
That's true. No, well, that's what I try and say to people is, I'm trained to do this. This is literally the only thing I do, is look after people when they're asleep. So it's like the pilot, his only job is to fly the plane and land it, and you accept that risk. And if you're on a bus, the bus driver drives you around, So if I try and let people look at it that way. I guess the only difference between those things and where those analogies fall down a little bit is you're not getting assaulted with a knife from a surgeon when you go and sit on a plane or a bus.
This is true.
So that adds a little bit to it. It's funny you mentioned the pilots and the airline industry, actually, because a lot of their safety data and procedures, there's been lots of analogies with that and with anesthesia in terms of checks and all that sort of stuff and taking off and maintenance and landing. So that's an analogy that's been made before. So although we get a little bit sick of it because, sometimes we take off with the wings on fire and sometimes there's shots being fired at us when we're asleep or when the patient's asleep. So it's not quite the same, but you know what I'm talking about.
No, absolutely. And as I said earlier, no two cases are the same, whereas, plenty of flights can be the same. And what you do in the book is you outline it's real life experiences, and it's from 1 year. So this is real patients, although, you say you've changed names and stuff and real colleagues. Even though this is, for the most part, very serious, there's a lot of lighter moments in there as well.
Well, yeah, I mean, if I wrote a book entirely about serious things or problems with health systems, I don't think it would be very readable, to be honest. It would be pretty dull. And I wanted to get across the fact that, an operating theater is our workplace, So, I mean, you sit in the background and you have the crack with your producers and the other staff. We do the exact same thing, It's we can't be serious and solemn all day, every day, because you'd run out of steam, So, I'm very serious when we're in the moment. But aside from that, that's what I tried to get across, is just sort of my observations and things I noticed between interactions with the other staff in the operating theater, because I don't think people appreciate just how many other people there are there, Like the other day, we anesthetized a 5-kilo baby for a pretty big operation, and there was 20 of us in the room looking after a small baby. So, right. People may meet an anesthetist and maybe a nurse or two, but beyond that, they're not sure who's there. So I wanted to sort of explain that to people as well. And on top of that, I thought, I wrote it as a first-year anesthetist. I'm nearly 3 years into the job now, but I also wanted to explain to people that, demonstrate that consultants, while you may be a consultant, you can still second guess yourself. You still ruminate about things. So you don't have all the answers just as soon as you walk in the door as a consultant. It's a constant learning process. And I think that comes across in the book, in that I think about things. I ruminate quite a lot at the start of the year, but I very much relax into the role by the end of it. So there's a few facets to the book that I wanted to get across. And I think those sort of things have come across pretty well.
In a way, you sort of you give a lot away and have to in the book. And sometimes I think it's a bit like a magician. You just don't want to know what's behind the trick. And sometimes you don't want to know what goes on.
Yeah.
A lot of people, when they're getting an anesthetic and they're going to be put to sleep, they have this fear about waking up. And is that just like, that just doesn't happen? Like, because people might have this fear about, waking up in the middle of an operation and half of their stomachs lying beside them in a tray. It doesn't happen.
It doesn't happen. No, that's great fodder for a horror movie for sure. But in reality, it doesn't happen. I guess theoretically it probably could, but if we're doing our jobs properly, there's 0% chance of that. And that's what most people ask. I've been asked strange things when people are going off to sleep, and commonly it's, am I going to wake up in the middle of the operation? Am I going to die? And then sometimes people even ask me if I'm an actual doctor. I had one chap who asked me, did I have to do a night course to become an anesthetist? But I told him I was actually a doctor and it was a bit beyond the scope of a 6-week night course, but he seemed happy enough either way. Yeah, exactly. Exactly.
And do people, I mean, when you're out, you don't do any talking or rambling, or do people, can you talk? Like,
oh God, yeah. Of course you can. I mean, the communication is a big part of the job. Anesthetists and surgeons. We've a.
No, I meant the patient. Would the patient ever talk? Like you talk in your sleep?
Talk? No, not at all. No, it's not the same as sleep. So you don't talk like that. No, your brain's switched off. You're not doing anything. You're perfectly silent. Yeah.
And every patient is different, so you have to judge, I presume, on like their age and their gender and their height and weight and stuff as to the amount that you give them. Is that right?
Yeah, exactly. Yeah. So you kind of, when we go and meet a patient before an operation, we try to, we go through the list of their medical problems if they have any, and their list of their medications, and then we look at the operation that's going to happen, and we sort of see, okay, so what's the surgeon going to do and how might that affect the person's overall physical health, and we kind of have to make adjustments based on that in terms of dosages or anesthetic plans or where somebody might go after the operation. So we kind of take all those things together and come up with an anesthetic plan. So I mean, it's all variation on a theme, but there are nuances to it depending on the patient and what operation they're having. Yeah.
You're a specialist in an already sort of a specialist area, in that you have a special interest in anesthesia for congenital heart disease.
Yeah, that's right. Yeah. So I went to Great Ormond Street Hospital in London when I finished my anesthesia training in Ireland, and I completed a fellowship in anesthesia for congenital heart disease. So you kind of, once you're finished, you've subspecialized within an area, and I found all that stuff absolutely fascinating. You've got things or configurations in your heart that you would never think would be possible to survive with, and yet people do, and the operations we do for that are pretty unique. So I worked over there for a year and a half, doing things like heart transplants and various other cardiac operations, and then came back to Dublin, where we do pretty much all the same things, covering the kids in the whole of the country. The only things we don't do are heart transplants. Those kids still go to the UK for those. But I found my little niche there, and it's absolutely fascinating. Yeah.
A great hospital, Great Ormond Street, because I have a sister who started out there, did her training there, worked there, then went off and was a pediatric nurse elsewhere, and is starting back in Great Ormond Street actually in research in January. So I'm not, I wouldn't say well familiar with the hospital, but most definitely aware of it and the great work that they do. And the great work that you do up in Crumlin as well. And a lot of it is outlined in this book. It's called Gas Man. And, some of it obviously very serious, but some of it's laugh out loud. And people just are going to be amazed by it. But it's Observations of an Anesthetist, and it's by Colin Black, Dr. Colin Black. Thanks a million for joining us.
Lovely. Thanks for talking to me. Take it easy.
Donegal Denture Clinic, Letterkenny. Denture problems, we can help. At Donegal Denture Clinic, we customise, personalise and tailor your dentures to suit you.